Wellness Episode 1, Organic Fit Kids. Learn about holistic dentistry. This episode is meant for parents and teachers.
Hi Gwen, what's wrong? I have a toothache. I got a filling the other day and it's been hurting ever since. That's not good. You should see my dentist. She practices holistic dentistry. It's all natural.
What do you mean by all natural?
She doesn't use mercury fillings or do root canals, which are dangerous and can cause health problems.
Oh, I didn't know that.
I can see if I can get you an appointment today.
That would be great.
Hello Debbie, this is Kathy Fraunheiser. I'm fine. Debbie, I have a friend who needs to see Dr. Carlson. Can you get her an appointment for today? That will work. We'll see you later. Debbie booked you for the last appointment of the day. We're going to need to go early for you to fill out some new patient paperwork. Here we are. Hi, Debbie.
Hi, how are you?
I'm good. How are you?
Good, thank you.
This is Gwen. She's a new patient and she's here to see Dr. Carlson.
Great. Welcome to our practice.
Thank you.
I have some paperwork here for you to fill out.
All right. Thank you very much.
Thank you. Gwen, I'm going to take you back to see Dr. Carlson now.
All right.
Hi Gwen, I'm Dr. Carlson. Welcome to my practice. I understand you have some questions for me about dentistry.
So what is holistic dentistry?
Basically, having all the knowledge of regular dentistry, in addition looking at patient body as a whole and seeing how the teeth will affect the body, including all the fillings that are there, or any existing fillings like mercury fillings or crowns or root canals, because teeth are connected to body organs and they interact together. So I am aware of how that all works, and when I look in your mouth I can have an idea of how healthy you are to begin with, and I can give you some suggestions on how to be more healthy and have more happy life.
Okay. And how is that different from other dentists?
Okay, so overall I would say we are like a cosmetic dentist in terms of that, we don't use, holistic dentists usually will not use mercury fillings and do root canals. So you're not going to place any mercury fillings, and if anything, people who come here request to have them removed, usually due to their health condition, or they just don't want to have it in the body. So in terms of doing this of dentistry, it's similar to cosmetic dentistry, but my training and my understanding of the body, makes me more likely to understand people who have some health issues, who have some unresolved conditions, and who go see different medical doctors, and their problems cannot be resolved. They have some immune system problems, or they have problems with some diseases that cannot be cured, easily. And usually what happens is the source of the problem is actually in the mouth. So I understand more about that, but in terms of doing this of dentistry, is similar to cosmetic dentistry. We use porcelain, we use plastics, and still I do take x-rays and I use anesthetic.
Okay, so why should a person see a holistic dentist?
I think it's a personal decision. If somebody really would like to be more healthy, or have less chemicals in their body, or know maybe how the mouth is affecting their body, that will be the reason to come see holistic dentists. Usually people will be a little bit more into what they are eating, into eating more organic foods, or thinking about protecting their body from chemicals like not smoking, drinking, those kind of things, and they basically want to have a healthier lifestyle, and they want to have teeth that do not affect their body. So, and also if they have issues with their health, somebody like myself would understand the relationship of root canals to the body, mercury fillings to the body, and maybe I could make their mouth healthier, which in relation would make their body healthier.
What are mercury fillings?
Okay, well, mercury fillings are those silver fillings. Some people look at them, they look silver, and they think they are just silver, but actually they are about 50% mercury. They have other metals mixed with it, and there's about 50% mercury mixed with silver, which is about 21% tin, and some other metals in it. So they basically are not so good for the tooth itself because they expand and contract with hot, and with cold they're going to contract. Like the mercury thermometers. It's the same with the fillings. Fillings will get bigger and smaller, bigger and smaller. Over the years, that actually produces cracks in the teeth, and then the teeth will actually crack and break, and people will end up with needing crowns or root canals, and or even the tooth extracted. So they are not good as a material nowadays because we have better materials that can replace bigger fillings, and also they are just not good from standpoint of toxicity. I mean, mercury is one of the most toxic chemicals that we have on this planet. So to have it in our mouth, it's not very safe. So that's what mercury filling is.
Okay, if those are so bad, why do other dentists use them?
Well, I think it's just industry of dentistry. Some of it has to do with insurance, that they are still paid for, and a lot of dentists do think that they are still fine, and in dental schools they are taught as being totally okay. But if you can think for yourself or think outside the box and say, okay, there's mercury in it, would I want to have this in my head? And is the mercury actually stable or not? It is not stable. It's going to actually come out of the teeth in terms of vapors and get into your system. I think they are just used because it's just what's happening. People are using them. A lot of regular dentists are going to use them who are not aware of it, that there is medical issue with it. So I think it's a patient who has to make a decision, do they want to have those fillings or not. I mean, insurance companies are going to pay for mercury fillings to be placed in the mouth, so if you want a plastic you may have to pay a little bit extra. But I do think it would be a good investment to pay a little extra and get material in there that is safer for you.
Okay.
So I think just generally they are not considered totally bad for you yet. We are working on it to kind of show this, but I think overall people still think, okay, it's a silver filling. So.
Okay. Well, can anyone remove those?
I think anybody can remove it. The question is, how safe is it? I mean, I have extra equipment that allows me to remove it more safely. First of all, tooth is isolated with a piece of rubber, and that protects you from the particles. When I'm going to take out the filling, you're going to have two kinds of exposure. One is the particles and one is actually vapor. Vapor you're getting exposed to every day if you have fillings in your mouth, because mercury vaporizes at 10 degrees Fahrenheit and our bodies are at 98 degrees. So, as we sit here, if you have mercury in your mouth, it's going to be actually coming out and getting into your system. And then it takes about a few minutes for it to get oxidized in your bloodstream, and then it gets placed into organs. It doesn't just sit in your blood, but actually gets put into organs like your brain, your heart, your kidney, your liver, so, and if you will be pregnant, it will be going into the fetus, into the baby, because it goes into high metabolic rate, into the organs that have high metabolic rate. So, when you look at safety of removing them, you want to make sure that, first of all, you don't get particles going down your throat into your belly, and they may stick there in your digestive tract and cause issues with candida, which is fungus, or just overall reduce the way of your body can, digest the food and then absorb it. And in addition, there's vapors. So dentists who are holistic or natural dentists will, they get a little bit extra training in terms of how to safely remove it. So like I said, a piece of rubber over the tooth, which creates the barrier. And if some people are claustrophobic to that, there is another way of doing it. There is a device called cleanup that comes from Sweden, sits around the tooth and creates like a little seal around the tooth, so then all the particles go inside the suction. And then second thing is basically having alternative air source and having big suction for the vapors. So I have some extra suctions right around your tooth that will take up the vapors, and also big suction that goes into the filters that will capture the mercury. In addition, I use a lot of water because I don't want to warm up the mercury. There will be more vapors released, if it's warmed up. And also I cut it out in chunks. So I try not to just shave it, and then you get more exposure, but try to cut into bigger chunks and remove them in chunks. So that's, how it is safer for you versus going just anywhere to have it removed. You may want to get, a little educated with that before you start.
Okay.
Okay.
And you mentioned root canals earlier. What are those?
Okay, so root canal is basically when the tooth has an infection or the tooth has trauma. I mean, they can happen from different ways, but the outcome is that the nerve is dead. So nerve is no longer alive, and usually they will give pain. It could be, from trauma you may just have pain. From infection you actually may have a swollen face, so something is wrong. So it's a dead tooth in a live body. So I personally, have an issue with that. Just from a standpoint, it's a dead tooth in a live body. It's a little organ, and you have no other organs in your body that will be dead, and you're still gonna have them in your body. Usually they're gonna be removed. So there's two choices when the tooth is, either about to be, dead, or basically it's already dead. It's either you can have it extracted, which you remove the source of infection, which is the whole tooth, or you can have a root canal done. So root canal gets, through the top of a tooth, inside the tooth where the nerve is, or used to be. Once the nerve dies, there's really nothing there anymore, but the empty space. And there's specialists who can do this, who I call endodontists, or general dentists will do root canals as well. The space is clean inside the roots, and the filling is placed all the way to the tip of a root, to the bottom of the root, and then on top the treatment is to put the crown on the tooth. So the benefit of doing root canal is that you can keep the tooth, and that allows you to chew the food and such, but there is also side effect to the body. The tooth, once it's dead, it has no more circulation to it. It's gonna put out into the body different kind of bacteria, which I call anaerobic bacteria, which do not require oxygen to live there. So you're gonna have a source of infection that's kind of implanted in your body, spilling into your system and disrupting your immune system and disrupting digestion. Now, it doesn't happen on everybody. Some people can handle that based on their immune system, but some people, when they have a lot of other issues with their health, may even develop cancer from root canal. I mean, there's relation between people having, root canals and getting cancer. So there's a chart of organs in relation to the body that is Chinese medicine. And Doctor of Acupuncture really have them in their office. I have one of those charts as well. So I can look at the tooth and I can see what, energy field or what organs it lays on, and usually that root canal that you have there will affect that certain organ. Like, for example, number 3 tooth, which is on upper right molar, will affect the thyroid, and the thyroid affects, of course, a lot of other issues in the body, like all the hormones and everything. So somebody who has a root canal there, and usually I'll see under his health history as well that they have a problem with the thyroid. Not always, but it's quite often. So root canals is basically a personal decision if you want to have it or not, but you have to be just aware of it, that it does have side effects to the body. So I will explain to patients, pros and cons to the root canal, and then some patients will decide, yes, I want to have it. Some patients will decide, no, I do not want to have it. So then the choice will be to extract the tooth, and then you can either place an implant there, or you can place a bridge, or you can have a partial, or you can have some other way of replacing it.
And can a root canal cause harm?
Yes, it can. I work with some natural medical doctors. Some are MDs, some are chiropractors, and other medical professionals. And I do get patients who actually are quite sick. And those natural doctors cannot do anything until their root canals are removed. It could be immune system issue like cancer, it could be some other autoimmune problem. And I find that working together with those medical professionals, once I clean their mouth, which means, remove the root canals, and oftentimes they have mercury as well, then actually their detoxing and their medical treatment that they're going to be using actually will work then. So I do see a variety of patients. Some patients are healthy who walk in here and they just want to have a healthier mouth and healthier body and no health issues in the problem. And I also see patients who are quite sick, who, for example, like stage 4 cancer patients who were told they have like 4 months to live, and they tried all the medical, regular medicine, and that has not worked. So now they're going to alternative medicine, and they find their way to holistic dentists who actually can help as well with, just removing the toxins from the mouth, so then their body can work more properly, immune system can work, enzymes and hormones can work more properly, and they basically have a chance of getting healthier. So if you don't have any other questions, we are just going to go in and start an exam.
All right, let's get started.
Okay, great.
Awesome.
Find out more about holistic dentistry by going to www.smileMakeoverDentistry.com. This has been a wellness presentation from Organic Fit Kids. Learn more about natural organic food, exercise, and wellness by going to www.organicfitkids.com.